Breaking the Perfectionism Trap: The Irrationality of Demanding Always Rational Thinking. This video explores the psychological intricacies of rational thinking, emphasizing the benefits of identifying and transforming irrational beliefs while avoiding the pitfalls of the perfectionism trap. Drawing on principles from cognitive behavioral therapy, CBT, and rational emotive behavior therapy, RBT, we investigate the dynamics of recognizing irrational thoughts, understanding their negative outcomes, and transitioning towards rational beliefs. The concise video underscores the importance of this process in fostering emotional well-being, resilience, and positive behavioral change while steering clear of the paradoxical trap of irrational perfectionism. Cognitive behavioral therapy, CBT, and rational emotive behavior therapy, RBT, posit that individuals' beliefs, emotions, and behaviors are interconnected, shaping their mental well-being. At the core of these two important second-wave behavioral models lie the concept of irrational beliefs, which are distorted thought patterns that can lead to negative, unhelpful emotions and maladaptive behaviors. This video aims to elucidate the psychological advantages associated with identifying these irrational beliefs, understanding the detrimental outcomes of acting upon them, and subsequently shifting towards rational beliefs. Recognizing irrational beliefs. The first step in the process of psychological transformation is recognizing irrational beliefs. These beliefs often manifest as cognitive distortions, such as all-or-nothing thinking, catastrophizing, and personalization. They also tend to take the form of demandingness, frustration intolerance, and global negative rating of self, others, life, or the world. Individuals may hold irrational beliefs about themselves, others, and the world around them. By practicing self-awareness and introspection, individuals can identify these irrational beliefs and understand their impact on emotional well-being. Negative outcomes of acting upon irrational beliefs. Acting upon irrational beliefs can result in a myriad of negative outcomes, including heightened anxiety, depression, and maladaptive behaviors. For instance, individuals who consistently engage in catastrophizing may experience chronic stress and fear of the worst-case scenario, leading to impaired decision-making and increased emotional distress. Over a long period of time, the stress caused by irrational beliefs can have a negative impact on one's health, physical as well as emotional health. Understanding the direct correlation between irrational beliefs and negative outcomes serves as a powerful motivator for change. Shifting from irrational to rational beliefs. The transition from irrational to rational beliefs is a fundamental aspect of cognitive restructuring within CBT and RBT. This process involves challenging and reframing irrational thoughts through evidence-based reasoning. By adopting a more realistic and balanced perspective, individuals can replace maladaptive beliefs with those that are conducive to emotional well-being and positive behavior that increases the likelihood that we better achieve our desired life goals in all areas of our life. Psychological benefits. Enhanced emotional regulation. The identification and transformation of irrational beliefs contribute to improved emotional regulation. Rational thinking allows individuals to respond to situations with a balanced and measured emotional response, reducing the impact of negative emotions. Increased resilience. Shifting from irrational to rational beliefs fosters resilience in the face of adversity. Individuals develop a more adaptive mindset, enabling them to cope effectively with life's challenges and setbacks. Improved interpersonal relationships. Rational beliefs promote healthier interpersonal relationships. By relinquishing distorted perceptions of oneself and others, individuals can engage in more constructive and empathetic communication, leading to stronger social connections. Effective behavioral change. Transformation of irrational beliefs is associated with positive behavioral changes. Individuals are more likely to engage in goal-directed and adaptive behaviors, leading to personal and professional growth. The psychological benefits of identifying and transforming irrational beliefs are profound. From enhanced emotional regulation to improved interpersonal relationships, the impact extends across various facets of an individual's life. Recognizing the negative outcomes of acting upon irrational beliefs serves as a catalyst for change, motivating individuals to embrace rational thinking and cultivate mental well-being. As an integral component of CBT and RBT, this process offers a promising avenue for personal growth, resilience, and overall psychological health. However, the paradox of being irrational about holding rational beliefs, often referred to as the perfectionism trap, or rationality perfectionism, occurs when individuals place unrealistic demands on themselves to always think and behave rationally. This perfectionistic attitude can lead to self-criticism, negative self-judgment, and heightened anxiety when one perceives a deviation from their idealized standard of rationality. Here, we will explore the dynamics of this paradox and discuss strategies to break free from the cycle of being irrational about being rational. Understanding the perfectionism trap. Unrealistic expectations. Individuals who fall into the perfectionism trap set unrealistically high standards for their rational thinking. They may believe that any lapse into irrationality is a personal failure or a sign of inherent inadequacy. Having high standards for oneself is fine. Demanding that one always attains those high standards and negatively judging the self when one fails to attain those standards is both irrational and unhelpful. Negative self-judgment. When individuals perceive themselves as failing to meet these rigid standards, they engage in harsh self-criticism and negative self-judgment. This self-flagellation can exacerbate feelings of inadequacy and contribute to a cycle of anxiety and stress that over time can contribute to poor mental, emotional, and even physical health. Challenging irrational perfectionism. Recognizing cognitive distortions. The first step is to recognize the cognitive distortions associated with perfectionism. All-or-nothing thinking, overgeneralization, and self-blame are common cognitive distortions that contribute to irrational beliefs about rationality. Cultivating self-compassion. Practicing self-compassion involves treating oneself with kindness and understanding, especially in moments of perceived irrationality. Acknowledging that everyone has moments of irrationality, and that it does not define one's worth is crucial for breaking the cycle of negative self-judgment. Developing a growth mindset. Embracing learning opportunities. Adopting a growth mindset involves seeing moments of irrationality as opportunities for learning and growth rather than as failures. Instead of berating oneself, individuals can view these instances as chances to enhance self-awareness and refine cognitive processes. Unconditional self-acceptance. Unconditionally accepting the self, mindfully and unconditionally accepting oneself can help individuals observe their thoughts without judgment. This non-judgmental awareness allows individuals to detach from irrational beliefs about rationality and accept the ebb and flow of cognitive processes without overly identifying with instances of irrationality and globally and negatively rate the self. Seeking support. Therapeutic intervention. Well-trained CBT and RBT therapists can be particularly effective in helping individuals with their irrational beliefs about rationality. A therapist can help individuals identify and challenge distorted thinking patterns, fostering a more balanced and realistic view of rationality. Setting realistic expectations. Redefining rationality. Acknowledge that being rational does not mean being perfect. It is essential to redefine what it means to be rational, recognizing that occasional lapses or emotional responses are a natural part of the human experience. Encouraging self-reflection. Regular self-reflection. Engaging in regular self-reflection allows individuals to examine their thoughts and beliefs without judgment. This introspective process facilitates a deeper understanding of one's cognitive patterns and provides insights into areas where growth is possible. Thus, being irrational about holding rational beliefs is a common cognitive trap that can undermine mental well-being. Breaking free from this cycle involves cultivating self-compassion, challenging perfectionistic thinking, and embracing a growth mindset. By adopting realistic expectations and seeking support when needed, individuals can develop a healthier relationship with rationality, recognizing that it is a journey of continuous learning and self-discovery. In conclusion, This video underscores the psychological benefits of identifying and transforming irrational beliefs while navigating the cognitive landscape of rational thinking. The journey towards rationality is marked by resilience, enhanced emotional well-being, and positive behavioral change. However, it is crucial to avoid the paradoxical trap of irrational perfectionism, recognizing that the pursuit of rationality is a continuous journey of growth, learning, and self-discovery. This video is intended to be educational in nature and is in no way intended to offer psychological, legal, or medical advice or treatment. If you think you could benefit from psychological help, please seek a licensed mental health professional.